In Nigeria, healthcare is not just unequal, it is a class barrier. And that barrier decides who lives and who doesn't. There are two Nigerians when it comes to healthcare. One waits in long queues on broken benches, hoping their turn comes. The other walks into air-conditioned hospitals and pays for everything in cash. This is Vital Signs Unfiltered. Today, we are investigating the parallel healthcare system, the one that determines whether you survive in Nigeria. Public hospitals serve the majority. Private hospitals serve those who can afford to escape them. And the gap is widening. Many of the doctors working public shifts by day work private shifts at night. More than 60% of Nigerians live below the poverty line, which means private healthcare is simply not an option for most people. A single specialist consultation can cost more than the monthly minimum wage, 70,000 naira. A surgery, sometimes 10 times that. Meanwhile, public hospitals are stretched beyond capacity, and in rural areas, many premier healthcare centers, PHC or healthcare centers, are understaffed, under-equipped, or closed entirely. This creates a brutal sorting system. If you have money, you can survive, and if you don't, you wait. And waiting in Nigeria healthcare is often fatal. Condition worsen, infection spread. What could be treated in hours become terminal in days. And for wealthy Nigerians, there is a third option. They leave. Medical tourism in India, the UK, and Dubai cost Nigeria billions every year. The elite are voted with their boarding passes, and everyone else is left behind. Because in Nigeria, healthcare is not just unequal, it is a class barrier. And that barrier decides who lives and who doesn't. This is Vital Signs Podcast, and sometimes the deepest divide in a country isn't drawn on a map, it is drawn at the hospital gate. Thank you.